webinar uh, series co-organized by Energizer, the Youth Depact, Youth Lead, Y Plus Global, YPER, Youth Rise, UNAIDS, UNDP, UNFPA, and UNICEF. My name is Damilare Oyedele, and I'll be your host and moderator for today's series. The ayKP Knowledge webinar series aims to shed light on the vital role played by adolescent and young people populations in leading and shaping initiatives. This particular session revolves around the theme of letting adolescent and young people population lead, okay, and focusing on sharing valuable insights and experiences from the perspective of these individuals who are the forefronts of change. And more importantly, okay, the significance of the ayKP leadership cannot be overemphasized by empowering and supporting ayKPs to take change, make decisions, lead initiatives. We unlock the potential for more impactful, relevant, and sustainable strategies in addressing issues that directly affect them. Today, we have experienced speakers in the ecosystem that will be sharing with us key interventions and experiences in the progress of the work. And we have Priscilla Ado, who is a communications graduate training Y Plus Global. She'll be diving in further as we progress to speak about supporting youth-led responses and what works. And also, as we move on today in today's session, we have Henry Okiwu, who's a technical operations lead at Youth Rise Nigeria, who will be diving further to discuss about, how can the Global Fund better support young key populations led responses. And also moving forward again, we're going to have Ariana Tran, who is the Executive Director, Venus Social Enterprise Community, and the President of the Vietnam Network of Young Key Affected Populations. We'll be diving in for that to learn more about, what are the issues of facing young key populations leadership at the country level that need to be addressed. And also we have our last but not the least speaker today is Clayton. Clayton is Senior Advisor, Civil Society Networking at UNAIDS. I'll be diving in for that to let us understand more about, the importance of community and youth responses. We have experienced speakers that will be sharing with us from core practical experiences of this. And so our audience, we're happy to have you join us for today's session. We know you're going to have a lot of questions as we progress in today's conversation. But however, please feel free to use the Q&A section to drop in your question and comments, your questions, and we'll surely address them during the Q&A as we progress after the speakers finish presenting. Without further ado, I'm going to dive in now to introduce, our first speaker for today in the person of Priscilla Ado. She'll be speaking to the role of Y Plus Global as a technical support provider, focusing on building leadership capacity of young key populations. Priscilla, the floor is yours.
Thank you very much, Dami. I hope I'm loud and clear.
Yes, we can hear you loud and clear. Please go ahead.
Okay, all right. So before I go into what Y Plus Global does, I would like to give a brief background on what we do as the global network of young people living with HIV. We are currently based in the Netherlands and South Africa and have been leading the voice in calling for the representation and involvement of young people living with and affected by HIV in political and pragmatic spaces that impact our health, rights, and well-being. So as Y Plus Global, we connect young people to each other, as well as onto global decision-making spaces. We began in 2005 as a program of the Global Network of People Living with HIV, that is GNP+, and eventually evolved in 2021 into a separate organization with our own leadership, staff, and strategies. So we are proud to say we have achieved independence registration as a non-profit global network as of March 2020. Y Plus Global basically embodies the ethical and meaningful engagement of young people living with and affected by HIV in all their diversities, and we play a pivotal role in enabling the leadership of young people to engage and thrive and represent our issues and voices in key decision-making spaces. So our programs apply a multifaceted approach to promoting youth leadership. And we do this by bridging the gap to enable young people to be ethically and meaningfully engaged in the HIV response as not only leaders, but also as partners and beneficiaries of the HIV response, and then connect other youth-led organizations to these key stakeholders and donors. So as a technical provider, what we do is, firstly, we do capacity strengthening of youth-led networks of young people living with HIV. Basically, we recognize the barriers to the essential work done by these youth-led networks, and we support them with support from key donors in investing in capacity building and strengthening of these organizations, focusing on youth leadership. So, for instance, in 2022, we granted funds to 113 youth-led organizations from 41 countries worldwide. In particular, the main work was on adolescent and young key populations from the work with Love Alliance for Youth and Count Me In, a few of the initiatives that we are currently running, which we are members of these consortiums that focus primarily on this cohort. So we empower youth-led organizations by providing capacity assessments, development of capacity building roadmaps, and other forms of capacity building at the national level as well. So this included training in organizational development, reporting procedures, financial management, and strategies. We strengthen the leadership capacities of adolescent and young key population networks and other SRH and HIV youth-led movements, continuously providing seed grants and funding to ayKP specific programs. So these grants focused on building the capacity and strengthening of youth-led networks and organizations, empowering them to be able to advocate for their rights and then promote their meaningful engagement and ethical engagement as well. So we do a lot when it comes to supporting the consultations and documentations of the lived experiences of young key population as evidence of programs such as HIV criminalization and young people. In November 2022, Y+ Global convened an online dialogue to explore how criminalizing HIV non-disclosure, potential or perceived exposure or unintentional transmission affects young people living with HIV, young sex workers, young people who use drugs, and then young LGBTQ+ persons. So this report has since supported ayKP programming with Y+ Global and informed the network's advocacy priorities. So at Y+ Global, we have many programs and projects that cater to the needs of young people from diverse backgrounds, in particular for adolescents and ayKP. We have Love Alliance, as I've already mentioned, for youth, and then Count Me In. So just to give you a brief view into what Love Alliance basically is, it is a 5-year program from 2021 to 2025 that is being funded by ACE funds and is committed to protecting, promoting, and fulfilling HIV and SRHR globally. Thus, the program or Love Alliance is all about unifying people who use drugs, sex workers, LGBTQI movements, and amplifying the diverse voices from these communities. It is also funded by the Dutch Ministry of Foreign Affairs under guidance and management by ACE funds. So Love Alliance brings together these key communities together with national thought leaders, including GALS, Sanpud, and Sisonike, and other regional grant makers such as UHAI, and there's EASHRI, AFI is DAO, and then, of course, we have GNP Plus as well. So Love Alliance is about us, people, and our power when we come together as communities. And this program focuses on the intersectionalities and interconnected experiences from the lived experiences and realities of young key population, and then uses this evidence in programming to create a long-lasting impact. So the main objective of Love Alliance is basically to build the capable, inclusive, influential, and mutually supportive key population movements in an unrestricted civic space. So another objective of the entire movement is to end sexual and gender-based violence, stigma, and discrimination against key populations, and lastly, to strengthen equal access to inclusive, people-centered, accountable, integrated HIV and comprehensive sexual and reproductive health services. So under Love Alliance, we have the Young Emerging Leaders Program, which began this year. So these young emerging leaders, also known as YELs, is one of Love Alliance key programs, which is focused on young key populations. So we are assembling an exceptional group of young advocates to engage and influence global policies and health governance spaces through these initiatives. So members of these YELs were capacitated to actively participate in program decision-making processes within their various countries to meaningfully engage in youth advocacy at various national, regional, and global levels. So these advocates were paired with community advocacy technical experts, who are known as CATs, for one-on-one hands-on coaching and mentoring. So we do not leave these YELs alone to go without being capacitated in any ways. We also pair them with technical experts to coach them, to mentor them, and to guide them in their advocacy journey. So these YELs have had access to tailored online learning models covering areas such as HIV treatment, funding flows, and public advocacy. So they meet monthly for moments of truth, where they have peer-to-peer learning sessions. And in these meetings, these advocates will share challenges, solutions, and lessons learned from their own work. So at ICASA, which was just last week, we had 15 young emerging leaders, primarily from Love Alliance countries, which are predominantly in Africa, with a few exceptions from Latin America and Asia. And they graduated from the program at ICASA, and this was one of the many successful programs at Y+ Global, where we train and build the capacity of young key populations to become stronger advocates on KP issues and also be agents of change within their communities. So now I'm going to go on to For Youth, which is a consortium. So For Youth is basically a consortium of 4 regional and global networks made up of Youth Lead, Y+ Global, Youth Rise, and YPA under the Robert Carr Fund. So all 4 networks are youth-led and have the common objective of strengthening the capacity of young key population and young people living with HIV in their respective regions and globally as well. So For Youth is basically aimed at utilizing respective country partners to access small grants from their various networks and to promote capacity development initiatives. Furthermore, this program has contributed to the institutional and operational strengthening of Y+ Global and provided funding to support programs that serve and targets key populations and other marginalized vulnerable groups. So through the support of Robert Carr Fund and coordination of For Youth, we have expanded our reach and impact to cover more countries in Southeast Asia now and South America as well, supporting 9 networks across this region to receive training on fundraising and the development of their advocacy plans to address and mitigate the dual pandemics, that is HIV and COVID-19. So the exceptional funding, which provided short-term impact funding to civil societies and community-led networks with a specific goal of applying lessons of the first 2 years of the pandemic, also supported community-led efforts to reach the most vulnerable, including creating more resources for HIV and COVID-19 responses for inadequately served populations. So as presence, support, and implementation of the program has mainly been in collaboration with J+ LAC, and which is based in the South American region and assembles young people living with and affected by HIV to address the challenges of young people living with HIV in the region and reflect on the strategic plan of the years for the coming years. So these assemblies include training and workshops on institutional strengthening, governance, advocacy, data collection, and operational maturity. So in 2022 and 2023, we developed and launched a service map for young people, which is available on our website, highlighting the 11 types of services young people and young KPs need. If you have the time, please check it out, as this is a really useful tool for youth-led organizations and young people seeking services. These youth-led initiatives are one of the many examples that demonstrate and underscore our ongoing commitment to capacity strengthening and empowerment of young KPs, which are commitments we have to support young people in all their diversities. So I'm going to come to a gradual close. And before concluding, I also like to mention the recent work we have done with UNAIDS and the Pact, such as the Uproot Scorecard and the work on strengthening youth-led responses, which was recently featured in the Let's Community Lead World AIDS Day report. It was awesome seeing that in there. Our involvement in these critical projects enables young people to provide youth-centered information and insights on the drivers of the HIV epidemic, including discrimination, inequalities, violence, and exclusion. The Uproot Scorecard is developed and powered by young people in all their diversities, with its implementation first beginning in 2021 and continuing into 2022. We launched the second phase in April and targeted 8 countries. That was Cameroon, Guatemala, Indonesia, Kazakhstan, Nigeria, Pakistan, Vietnam, and Zambia. So this was done in collaboration with Youth Lead, UNAIDS, the Youth Pact, and country lead organizations. More recently, we worked with UNAIDS to develop guidance on key actions to strengthen sustainable youth-led responses and to help address priorities such as youth leadership and engagement, youth-led monitoring and research, youth-led service delivery, advocacy, campaigning, and sustainable financing. So we hope to launch this guidance in the first quarter of 2024, which can be used by various stakeholders in the HIV response and complements the already existing programs and projects being led by youth-serving organizations and UN agencies. So all of this work that I've spoken of demonstrates how we actively work and are working to address gaps and barriers within the HIV response, collecting data and conducting research to support those most marginalized, including young key populations in all their diversities. Thank you very much, Dami. Over to you.
Thank you so much, Priscilla, for that detailed presentation of your work at Y Plus Global. Amazing work you did there. You mentioned around capacity development, on advocacy, on fundraising, and also supporting through consultation and documentation. These are amazing interventions you've mentioned, benefiting and impacting across various continents. You've mentioned there. Amazing work you share with us. Without taking much of a time, we're going to proceed on to the next speaker, which I'm going to invite now to proceed on, is Ariana Tran. She will be, sharing with us around what are some of the issues affecting ayKP leadership at the country level and how, they are overcoming these issues at the country level. Ariana, you have the floor.
Yeah, I'm here. Hello, everyone. Can I, oh yeah, see you. Can you hear me?
Sure, we can hear loud and clear, Ariana.
Yeah. Hello, everyone. My name is Ariana. I'm 30 years old. I'm from Vietnam. Today, I'm very honored and nervous to participate in sharing my experience when participating in CCM in Vietnam. I hope that if the process of speaking some of the words I say will not be correct, so please forgive me. Yeah. I'm president of the Family Group of Young People Population, and also I'm the executive director of Venus Social Enterprise Community, the social enterprise for transgender women in Vietnam. Besides, I'm executive board member of Youth Lead 2022-2024. I'm member official of CCN Vietnam for CCN Vietnam for Global Fund 2023-2025. I present of the young transgender community. Last time I joined CCM as a research member, and we present the young MSM group. But in the new term, CCM Vietnam had an additional position representing transgender women. So I'm very lucky to have only one contestant. The only candidate is a transgender woman running for office. Yeah. Can we do next slide for me? Yeah. The first, I would like to share about the test that CCM member in Vietnam must do. CCM Vietnam member will represent the voice of the young key population and ayKP community. Collect and contribute opinion from KP group and project right in Global Fund, sponsor project, TB, malaria, HIV, and finally is monitor, supervise, and evaluate the effectiveness of the project for 3 years. In CCM Vietnam, regularly hold regular meetings every 2 months to update important information between the community and Global Fund. Before joining CCM Vietnam, I thought that period term did not have strong participation of ayKP. The majority are still the need of KP group age from 20 to 60. For the transgender women community, this is still not considered a priority issue in HIV prevention and treatment. HIV service and currently still integrate with MSM group. Then we strongly recommend that ayKP should be represented and transgender should be represented as member of CCM. And clearly, CCM is also very care is ayKP and transgender, young transgender women. Global Fund period 2021-2023 pilot area and prevention for transgender women. In the next stage, transgender people will continue to research, care, and support from Global Fund. In addition, the results show that the HIV in phase group was the young KP population group. Yeah. Thank you for listening. So I will answer all questions via the chat box. Thank you.
Thank you so much, Ariana, for that brief and concise evidence you shared with us about your work in Vietnam. I know our audience, we know you have a lot of questions for our speakers. Please drop your questions in the chat box and we'll respond to them after the presentations. I can see we have a question already, which we're going to respond to in the course of this discussion afterwards. As we progress on to our next speaker, I'm going to invite forward to share with us Clayton. Will be sharing us reflections on points from speakers and highlights, UNAIDS work around CLR and YLR. Clayton, you have the floor. Over to you.
Thank you very much, Damilare. I hope you are hearing me well.
Loud and clear.
Thank you. Thank you for all those that joined us today, and thank you also for the speakers, Priscilla and Ariana, for sharing your stories and your work on promoting youth-led responses. This is really appreciated to see this very good work in different regions of the world. I have a very brief presentation that I will try to focus on the importance of scaling up community-led and youth-led responses. Next slide, please. As you probably know, the political declaration, the 2021 political declaration on HIV, committed for the first time to the JIPA principle and to empower communities of people living with HIV at risk of and affected by HIV, including adolescents and young people, among other priority populations. This inclusion will be done through inclusion of these communities in decision-making, enabling environments for civil society organizations to operate, financing for community-led responses, community-led monitoring and research, and also scaling up community-led service delivery. Next slide. Regarding the service delivery, we have a very bold target that we call the 30, 80, 60 targets, that it's about increasing the proportion of services that are led by communities. And we have these targets because we know that services that are provided by communities themselves can be more effective in reaching communities, especially those that are marginalized or criminalized and discriminated. So the targets says that we would need to have until 2025, 30% of testing and access to treatment services led by communities, 80% of HIV prevention services led by communities, and 60% of programs to support the achievement of societal enablers also led by communities. Next slide, please. And the Global AIDS Strategy recognizes the importance contribution of young people to the HIV response. And this is reflected in the way that we have one result area in the Global AIDS Strategy that is fully dedicated to the youth leadership. And the result area talks about young people fully empowered and resourced to set new direction for the HIV response and unlock the progress needed to end inequalities and end AIDS. So for these reasons, considering this result area, we at UNAIDS, we have been focusing on the leadership of young people as key partners for the sustainability of the HIV response and for achieving the community leadership targets of the political declaration, including the 30, 80, 60 targets. Next slide, please. But one important thing that we need to recognize is that we know that youth and also key populations, they are not an homogeneous group, but a diverse community with a diverse set of needs. So through our work at UNAIDS, that my colleagues Garrett and Alicia, they lead our work with youth networks here at UNAIDS, through our work with the Adolescent and Young Key Populations Partnership, with our co-sponsors of the joint program and the youth networks, we want to ensure that young people in all their diversity are supported to be leaders of the HIV response. With this renewed focus on the important role of communities in leading the global AIDS response, it's important that we support and document the role that adolescent and young key populations are playing in the HIV response. And just in this few minutes that we have in this webinar, we have already seen how important and how impactful youth-led responses can be. Next slide, please. But we have some challenges, and one of the challenges that we have is that we have gaps on data, especially about key populations and young people, youth from key populations. When we try to analyze these intersectionalities of different communities, we still have a lot of gap on data. And we know that data is key for driving advocacy, and community-led monitoring generates data that, for example, UNAIDS and countries, they cannot generate on their own. That's why UNAIDS has also been supporting and advocating for the support of community-led data and research. In the coming year, we have some exciting opportunities and pieces of work that have been developing under the Global AIDS strategy. One is the launch of the guidance on supporting youth-led responses, which we see as a key document, not only to support the work of this partnership that we have, but also to support all youth-led organizations in implementing HIV programming. We have also worked closely with Y+ Global to develop this guidance, which was developed based on a very participatory process led by the PACT in 2021 that helped us, that developed the definition of youth-led responses, and that is the base of this guidance. And this publication will also support us, UNAIDS, co-sponsors, governments, and other stakeholders to make sure that youth-led responses is mainstreamed within the HIV response. Next slide, please. I think that was my last slide, but I would like just to thank you, all the organizations represented here today. I was very excited when I was invited. Thank you, Garrett, for inviting me to be on this webinar today. I think having this platform where youth activists and with youth-led organizations can share their work and their knowledge is really very, very much important. And I really thank you for the work you are doing in the different regions. Thank you very much.
Yeah, thank you so much, Clayton, for those insightful reports you just shared with us around, we have shown how, impactful and important, youth-led responses are. You also touched base around the gap we have in data and also the community-led data and research that is necessary, and also mentioned things around, the report that we published around guidance and supporting youth-led responses. And these are insightful, interventions you've mentioned there that has been driving progress and also to continuously improve situation of things as we progress. Thank you so much for those insights, Clayton. As we progress today, our audience, feel free to drop your questions to the chat box. Okay, we're gonna go on to our next speaker in the person of Henry. He will be diving in further to discuss with us around the role of young key populations advocating for the needs in programming spaces. We dive into share small lessons around the global funded ayKP interventions in Nigeria. Henry, the floor is yours. Please go ahead. Is Henry still here? I think we might have lost Henry. Okay, so we're gonna just dive into the questions we have in the chat box. I can see we have a few questions already. I can see we have 3 questions already that are directed to all the speakers, and I'm going to take time to read this question out so we can all respond to them as it applies to us. The first question we have here is from Eric Sinaboye. It says, what have been the practical steps young key populations have taken to combat stigma and discrimination, especially in cultural spaces where since it's mostly sexually transmitted, it is even a taboo to talk about it? Okay, following the theme for this year, let communities lead. What partnership needs to take place to ensure that we all achieve overall you equals you. So this is a question we have here from Eric, and Priscilla, did you want to jump on this question? What are your thoughts on this question by Eric?
Yeah, so just to share my piece, I think when I was sharing the technical assistance that Y+ Global provides, I mentioned a couple of initiatives that are currently ongoing. Because this is a ayKP specific question, I'm going to lead it to the Love Alliance initiative that is, as I mentioned already, being managed by Love Alliance in collaboration with Y+ Global and other organizations as well. So this program specifically focuses on young people who are young people living and affected by HIV, and as well as young KPs, and also young people who use drugs. And so these are these young emerging leaders who are being trained and being coached to be able to interact and engage leaders within their country and globally as well, to share their stories and the realities they live as young KPs, and how discriminatory laws within the countries are limiting their abilities to access services, especially SRHR services and HIV-related services. So we have seen great success with that program within the first 2-3 years, and I think it is something that can be replicated by countries, other countries as well, seeing as it is important to have the young KPs themselves being empowered to be able to interact and push advocacy within their countries. So, because you cannot speak on behalf of these people all the time, it is high time that we have these young KPs empowered to be able to interact with these leaders within their countries. It is very, very crucial to have them at the forefront, to have them in these engagement sessions with high-level leaders. And I know that may be very, very difficult, seeing as I come from Ghana myself, and it is not easy to have even KPs, in a space with leaders as leaders. But it is very important that we empower them to be able to meet with this and have engagement with these leaders. And I think it is also very important to know our allies within the government system, knowing who our allies are. Currently looking at the LGBTQ and anti-gay law within Ghana, it is important to know the people we can depend on, or we can depend on as allies within the faith-based organizations and within the government systems, to be able to help drive against such a policy coming up. So I would just like to leave it at that and head it back to you, Dami. Thank you, and over.
Yeah, I mean, interesting points you mentioned there, I must say, Priscilla, around empowerment, empowering YKPs to push advocacy in their countries themselves. They've been at the forefront of progress, and also, knowing who our allies are. That's very important. But I'm also keen to hear from other speakers here with experiences in such, based on the question asked by Eric and from the response Priscilla gave. Okay, what has been your experience thus far, and what will be your take on this particular question? Ariana, you wanna try? Clayton, you can go ahead first, and Ariana, hopefully after Clayton.
Oh, thank you very much. I would just like to mention just UNAIDS works with many other partners in the global partnership to end HIV-related stigma and discrimination. We have several community partners that are also contributes with the global partnership. I think we have some youth-led organizations that are also part, and I don't know at this moment how many countries, but we have now an increased number of countries that joined the global partnership, and I think it can also be a good platform to work on issues related to addressing stigma and discrimination affecting young key populations. We have 6 areas of work in the global partnership. One of their areas, for example, is education. So working to address any form of stigma and discrimination in education settings. And I think there is a lot of potential of using the global partnership as a platform to connect and to join forces to address this work. And just also reinforce what Priscilla said, I think that it's really great, the work of under the Love Alliance, of bringing together the different networks and communities, because we know that the anti-gender and anti-rights movements is very well organized and very influential. So I think it's really important that the different communities and the different key populations join forces to try to respond to this pushback on human rights. Thank you.
Thank you so much for that follow-up response to the question. Clayton. Ariana, do you have any comments you want to share on this particular question briefly, or we should just move on to the question that we have? Ariana.
Yeah, I'm sorry, what's the question?
Okay, we had a question earlier asked around, what are the practical steps to combat stigma and discrimination in cultural spaces where, it's a taboo to talk about this. So I'm just curious to know if there are comments you want to add on this question. If not, we can move on to the next question we have, or we can get your comments on those as we progress. Okay, it appears I lost Ariana. So going back to the question, to the Q&A box, we have a lot of other questions coming in now, and I mean these are questions that are all interconnected. I'm gonna take this next question dropped here by the anonymous attendee that says that is there any country that has any program that supports in a way for stateless population in your country? I'm not referring to refugees or immigrants, but those who are born with one parent who are in a citizen of a country or was born without being registered in a national registry. This is a very unique question, and I'm curious to know who among the speakers are willing to take this up. Question really second: is there any country that has a program that support in any way for stateless population in your country? I'm not referring to refugees or immigrants, but those who were born with one parent who is a citizen of the country or was born without being registered in the national registry. Priscilla, I would love to come back to you to start with you again on this particular question. If you have experience on this through the Love Alliance project, please feel free to share with us.
I'm still trying to understand the question, unfortunately. Stateless, I will just need a brief understanding of what the question really is. Let me read it.
So you can read the question. As you read that, we're going to dive into other questions that we have. Also, other questions in the chat box here, which we'll love to take, and progressively we can come back to the question as we go on. Okay, so another question here by one of the anonymous attendees states that how do we get at risk? Wait, how do we get at risk minors in my country? It's under 18 to get them for testing without consent of legal guidance, as if they are tested either by healthcare or workers or community-based testing. Both can be persecuted. Okay, Priscilla, do you get this question?
I get this one. Yeah, I get this one, and I would like to answer this because it's also a question I get a lot from young people who work in HIV in communities. So with this, I think one thing that I advise them to do, as the question has already answered on, it is illegal to test a minor without a legal guidance consent. So it is very important that counseling, this is where counseling comes in, to counsel the legal guardian on the importance of testing, making them understand that it is life and death. And it is very important that if they care about the health and well-being of their ward, they allow them to be tested, and because without testing we will not be able to know the status. And also counsel the legal guardian as well to get tested, because I mean everyone has to know their status. So it is very important to do this. And again, please do not go behind a guardian to test without them knowing. There are very serious repercussions to that. So if as much as you do your counseling and they still say no, there's really not much you can do at this point. Again, remember they are the legal guardian. The minor, the child is under 18, and so there is not much you can do. But what I would like to do, that whenever you have the opportunity to have engagement with health representatives within your country, talk about the age of consent for HIV testing, and then bring this issue up as well, so they can have sort of a review of whatever law or policies are in place when we are looking at age of consent for HIV testing within your country. Over to you, Dami.
Yeah, thank you so much for reiterating that point and for making this clear for us to understand there, Priscilla. Clayton, do you have additional points to add on this question that has been responded to by Priscilla?
Yep. Maybe I would just mention that this is also an area that UNAIDS works when we talk about legal enabling environments. We are talking about changing the laws, any laws that represent barriers for communities to access HIV services, and including those barriers that adolescents and young people may face. So UNAIDS works in that sense in advocating with governments to change laws and procedures that represent barriers for the access to HIV testing and access to treatment and prevention. Thank you.
Yeah, thank you so much, Clayton. And one thing you mentioned there that also aligns to what Priscilla said is, laws and procedure that create barriers, right? And these are the things we should continuously work on as we progress. And go to the last question I can see here in the chat box, which says from Chikwekwo, sorry if I pronounced your name wrongly. It says, how can we make sure that as young key populations be fully funded to advocate for improved service delivery and be able to meaningfully engage in terms of policy advocacy and strategy development? Also, as young YKPs, how can we also get core funding to put in place proper structures and strengthen us in doing our work? I mean, this all goes to around funding and resources, putting structure in place and pushing advocacy. Okay, I would love to start with you, Clayton, if you're able to jump on this, and from there I go to Ariana, and from there I go to Priscilla. I'm sure she'll love to share more about the Love Alliance work in this regards. Yeah, over to you, Clayton.
Thank you. No, thank you for the question. I think this is very important. And we were just yesterday here, we are having the UNAIDS program coordinating board meeting here in Geneva. And yesterday we had a side event co-organized by UNAIDS and Robert Carr Fund. And of course, the topic of the discussion was funding for community-led responses. And we have highlighted how the Robert Carr Fund is very unique in that sense and very important because it provides core funding for the networks. And I think I saw that Priscilla mentioned the four, I'm sorry, I forgot the name of the four youth networks that came together and that are funded by the Robert Carr Fund. And I think that it is really what would need to be expanded, and UNAIDS is a partner of the Robert Carr Fund. And yesterday we highlighted the importance that other donors adopted the same model and provides core funding for community-led organizations, including those led by youth, by young people. And our last report also that was launched in the World AIDS Day, Let Communities Lead, also brought this issue of the need to make sure that at the same time we have an increasing recognition that communities are important, that communities doing a fundamental work, but when it comes to resources, this is not, there is no match between the recognition of the importance and the level of resources. So UNAIDS has also been advocating to make sure that communities receive the resource they need to play the fundamental role they need to play. So I will stop there. Thank you.
Yeah, thank you so much, Clayton, for sharing those little insight from what UNAIDS is working on first. Ariana, are you able to give us your experience in this regards? Over to you, Ariana.
Yes, so I think it's very important. So I can answer as a participant in CCM or youth league member. So I can only acknowledge the contribution to CCM youth league. I think so.
Yeah, thank you so much, Ariana, for that concise response. Priscilla, I know you have a lot to share about this, about the Love Alliance project, because I know you spoke about this earlier in your presentation. But listen, okay, tell us everything. So let us get to hear from Yeah, tell us everything the next 4 or 5 minutes. Over to you, Ariane. Take your time. Yeah.
All right, thank you, Dami. So, in relation to what the question is asking, how we can make sure Yankee populations can be fully funded to advocate for improved service delivery. I think it's very important that Yankee population communities join an existing movement within the space, because in this day and age, there are so many community organizations, community-led organizations, and it is difficult to be seen if you are not part of an existing movement in country and internationally as well. So it is very important that if you are part of a community-led hip-hop organization, you are not working in a silo, but you are working together with the movement in country and out as well. And when it comes to fully funded questions, those are a bit tricky on my side, as I am still learning within that space. But one thing I can mention, or one thing I'm well aware of, is the Global Fund, GC7. Which is the grant cycle 7, which came to an end recently, and it's even in progress. And in my country, for Ghana per se, I know a lot of interventions were made for Yankee populations, and also for trans people as well. So I think a lot is going on. And it is very important that you are within movements within your countries to know the funding opportunities available. If you are alone doing as much work as you are doing in your own corner, it is going to be very difficult to secure funding if you are not within a larger movement, especially in country. So one advice I will give to this person is that know who your CCM members are, the country coordinating mechanisms, know who the PRs, the principal recipients, and the sub-recipients within the grant cycle 7 in your country is. It is very, very important. Once you know who these people are, you are able to know the way forward in how to join whatever movement is ongoing. There is definitely going to be a larger KP organization within the CCM, and even a civil society that is implementing KP specific programs. You may not know, so it is important to know, reach out to these people, and then that will open your scope and give you opportunities that you did not have before. So that is what I would like to say for that, Dami. Over to you.
Yeah, thank you so much, Priscilla, for that insightful response and sharing the practical experiences. But before this question about we need to address this question around the statelessness, which I think the person in the question gave further clarity around, my question on stateless population are actually referring to non-citizen of a country, not immigrants, and also not a refugee. This population has no right to education or free healthcare, etc. Or most end up being sex workers and are involved in drug use because of their sex work, from testing to treatment, all blood tests are done by themselves. This is a hidden population that no one really care or deal with. Priscilla, you want to start by responding to this? I mean, based on the context earlier, and from there we go to Ariana, because Ariana also wanted to comment further on a particular question, and from there we go to Clinton and we round up to this discussion. Priscilla, do you get clarity now on this question in particular?
Yes, I do. So this is more of a government registration or citizenship issue, and from how he has explained it, it makes more it gives more clarity on the issues they are going to. So I would classify these people as other vulnerable populations, the stateless population that doesn't have citizenship, but I don't think that would restrict their access to healthcare. Like, as he's saying, that they do not have a right to education or free healthcare. Again, we do not know what country you are from, so this is going to be very difficult to provide insights on. But I think it all starts from getting citizenship within your country. That is getting registration, a birth set, and then eventually a passport, then eventually a health insurance card and all these things. So it starts from getting registration. And I don't know if any of the other panels know how it goes, what the international procedures are, but I know in country you have to either go to, well, he's saying they are not a refugee or migrant, so they just don't have registration. And we do have a lot of people like that within in Ghana as well. So the first initiative is to actually get a birth set, and that is eventually your key to getting all the other certifications that get you recognized as a citizen. So it is more of a personal initiative by these individuals. You have to take the step, or be on the lookout, or look out for civil societies that help people who do not have citizenship, which I do not have expertise in giving advice on. So over to you, Dami.
Yeah, thank you so much for that insight, Priscilla. Over to you, Ariana.
Yeah, I want to share about receiving resource in Vietnam. Everything is difficult. First, you must have legal status. Approval must be obtained from Vietnamese government agents such as the Department of Planning and Investment and the city, people, committee, because there is clearly a degree no 80 for receiving foreign aid. Yeah, I want to share for this.
Thank you so much for the response. Sorry. Thank you so much for that, Ariana. Going back to the question we have on stateless population. Okay, Clinton, are there experiences you want to share on this from your perspective? You know, what could be done, what can be done, and what can we do in this unique situation of stateless population? Over to you, Clayton.
Yes, thank you. Thank you for the question. I am afraid I don't have information about this specific situation, but I think it's it reminds us on the multiple and intersecting vulnerabilities that young people might face, depending on so many things. So I think that as said in the beginning, young people are not an homogeneous group. So paying attention to this multiple and intersecting vulnerabilities is very important when planning and when implementing programs for youth. But yeah, maybe I can say that maybe we can try to see if we can get more information on that, and maybe try to send to the person that is requested. Over.
Great. Thank you so much to our speakers for giving us these insightful experiences and impacts of what you're doing and the work you're making. We're glad to have learned a lot from you today. And of course, to our audience, thank you so much for taking the time to stay with us until this moment and for the interactive questions you've asked and how we've dived and progressed in this conversation. As we progress from this discussion, my colleague Garrett will share with us the recordings and the presentation documents, so you can further study them and get to connect with the speakers and share more questions you want to show them. And we believe, you know, this is as we progress, we're having more of these conversations in the next couple of months as we progress. So look out to our online platform to get more information about how you can join for the sessions, and we can continue to progress discussion and not just discuss about them as we engage, mobilize, and support follow our ayKPs in our various countries. To our audience and the participants and the speakers, thank you for your time. We appreciate you coming today to share with us this experience and to interact with us. That'll be the end of today's ayKP knowledge sharing webinar series. Until next time, we will come again to join us today, to join us on our episode or session of the webinar series. My name is Damilario Oyedele. Bye for now.
Thank you. Bye.
Thank you.
Bye.
Thank you. Bye bye.